Hi, Dr. Anna Chacon, board certified dermatologist, and today we're going to be critiquing a video talking about comedone extraction. And basically, this is right behind the ear. Comedones or epidermal inclusion cysts can occur anywhere. And in this particular patient, we see that they're undergoing comedone extraction right behind the ear. This is full of sebum or sebaceous tissue. Smells kind of like rotten cheese when you squeeze at it or take it out. And of course, it's one of my favorite things to do in clinic and favorite things to watch. It's very satisfying, both for the patient and the dermatologist as well. And very easy to do. You might even have an esthetician do this, but of course, if it's something more invasive involving lancing or any sort of procedure or surgical excision, such as that of the cyst, that's best done by a dermatologist in an office setting. And these are very common on the nose. You can see that lots of the open comedones here are very similar to ones that you might find in very sebaceous tissues, such as a nose. There's open and closed comedones. These are blackheads versus whiteheads. Blackheads typically have a oxidized center or blackhead on the top or black tip, and whiteheads are typically closed and whitish in appearance. And they could also be removed with comedone extraction or lancing. And we definitely have a lot of these in the office, and very satisfying to do and actually not that hard. You do want to have this done by a dermatologist so that you don't get prone to infection or it doesn't get more inflamed than it already is. And you can see this circular cyst probably needs a surgical excision and can't just be squeezed out very easily. Here, they're just dabbing the top, and you can see that sebum is coming out, lots of sebum. And this is sometimes what you would see in a ruptured cyst. It just is able to be squeezed out and until it basically collapses. You do want to make sure that the cyst wall is completely removed. Otherwise, it does have a significant chance of just growing back and regenerating. And this is typically an 11 blade that we use on the top. And then we just extract the cyst from the center and remove the contents, and remember to always send it to pathology to make sure that it is indeed a cyst and not something more concerning. And that's pretty much it. And these can be very, very large. They can appear anywhere on the body. In this case, we're looking at the posterior ear, but they're very common on the back, scalp, and other areas of the body. And that's it. Thank you so much for tuning in, and nice to see everybody. Dr. Chacon.